There are reports that the coronavirus has responded to treatment with malaria medication, but for now there's no cures. Health officials are now calling the illness a global health crisis.
In a recent piece in The Atlantic, Dr. James Hamblin says that while it's likely you'll get the coronavirus, it probably won't be life-threatening, and the challenge is containment. Dr. Hamblin joins us now via Skype to tell us that what he means. He's a staff writer with The Atlantic and a lecturer at the Yale School of Public Health. Doctor, thank you so much for joining us. We really appreciate it.
Thank you for having me.
Absolutely. So, Doctor, you wrote a headline which was a little bit alarming to some people, but when I read it, it seemed to make more sense about the coronavirus, which is that I think you quoted a Harvard public health scientist, about 40 to 70% of the global population could be infected, but that the lack of deadliness of the disease is what makes it that it's going to be so widespread. Just lay out for the viewers, because to not be alarmed by this necessarily, maybe to be prepared, and what this might mean for everybody's daily life.
Sure. I certainly don't want to cause alarm and never would suggest panic. And with that headline, the most important caveat is that no one is suggesting that most people will get severe disease. These are early projections about exactly what will happen, but we do know that the disease can cause mild and even asymptomatic infections. So it remains to be seen exactly what percentage of people develop severe disease and who experiences something more like a cold or a bad flu. And what we need right now is more data to help us understand who needs to be treated at higher levels, exactly when we should go in to get tested, and how we can allocate resources appropriately to make sure that the high-risk people are getting the care that they need.
Mm-hmm. And why do you expect it to spread so widely?
It's a virus that does seem to exist in a sort of dangerous middle ground. So most cold viruses are very easily transmittable, but they don't kill the host, the person. That's not an interest of the virus. And that makes them difficult to contain because they sort of cause a mild cold, and people will often be up and around, still going to work, still out in public, coughing into their hand and then shaking somebody's hand, versus the less transmissible diseases, which tend to cause severe disease, and someone either dies or is in the hospital or definitely stays home because they feel really sick. And those diseases tend to be more localized, like SARS and MERS and severe flus. And this is in a middle ground where it seems to be transmissible and can cause severe disease, but doesn't always. So people will be out and around and maybe having mild symptoms and possibly spreading it.
Right. Doctor, what do we know about the mortality rate on this? Because one of the more irresponsible things that I've heard is like, oh, it's just like the flu, don't worry about it. But some of the data that's coming out of China shows that this thing has a 20 times higher mortality rate, and it particularly targets the elderly. So what do people need to know, maybe who are immunocompromised or elderly viewers, what do they need to know in order to protect themselves?
Well, the comparisons to the flu are not bad. A severe flu can have high fatality rates. We don't know exactly what it is right now because of limited testing. We have one study in China that is early, but put it around 2%. But we still globally are mostly only testing people who are very sick. And so that will make the rate seem higher. Once we start just testing everyone or screening and doing big studies, we'll probably be catching more mild cases, which could bring that down. But the flu is very deadly and dangerous and kills hundreds of thousands of people a year. And so to compare it to the flu is not to downplay at all.
Okay.
So to what people should do, as of right now in the United States, the recommendations are similar to during a bad flu outbreak. Stay home if you can, wash your hands a lot, certainly don't cough or sneeze on people, and the obvious things. No one is recommending emergency type scenarios right now, but should be starting to think, especially as local public health departments are doing, about how we would handle increases in cases.
Yep. What about individual precautions ahead of getting sick? Buying resources, different preparations. I mean, what would you recommend for families at this point?
I don't see a reason to be hoarding resources as if the world is going to shut down. Some people have recommended making sure that you have enough medications that if you have to call in sick, and that if transportation becomes difficult because of maybe public transportation being shut down temporarily, things like that, that you could be able to get by at home for a little while, which are generally good precautions anytime, good measures to take anytime. But it will be important, if this does get very bad, that people aren't hoarding resources and shutting down things unnecessarily. We'll have to be thoughtful about, particularly in the cases like surgical masks, that those go to the people who most need them,
Right.
and that the people who are able to work still go to work, and that things don't shut down for entire months that don't need to be. So yeah, it'll have to be a deliberate, thoughtful process about how to allocate resources.
Well, Doctor, thank you so much for joining us. I really appreciate it. It's a very informative piece. I encourage everybody to go to read it.
Thank you for having me.
Absolutely. We'll have more Rising for you right after this.